Stop stretching your piriformis. If you have sciatic pain into your glutes and down your leg, and someone told you it's piriformis syndrome, there's a very good chance that's not the real problem. And if you treat the wrong muscle, you can waste months chasing relief that never comes. Let's look at what's actually more common. Before you spend hundreds or thousands on appointments, before you commit to injections, before you accept surgery without clear neurological findings, you need to understand one thing. Radiating leg pain does not automatically mean nerve entrapment. And statistically, piriformis entrapment is not the most likely explanation. There's something much more common: muscle trigger points. Trigger points in the gluteus minimus muscle can refer pain into the buttock, down the outside or back of the leg, sometimes into the calf, even to the ankle. That referral pattern can mimic classic sciatica almost perfectly. The quadratus lumborum muscle can perpetuate the same pattern. So the pain feels neurological, but the source is muscular. In 2018, researchers evaluated 997 chronic pain patients in secondary pain clinics. 82% were diagnosed with myofascial pain syndrome, trigger points. 82%. 75% reported significant short-term improvement with trigger point treatment. 72% reported long-term improvement. That's not rare, that's common. Now let's talk about the anatomy argument. You've probably heard the sciatic nerve runs through the piriformis. It's getting compressed. But here's the reality. 83 to 90% of people have the nerve passing below the piriformis. 10 to 17% have anatomical variations where the nerve passes above or through the piriformis. Those variations are routinely found in people with zero pain. Seeing that on MRI does not prove entrapment. Anatomy alone is not a diagnosis. True sciatic nerve entrapment exists, but when it happens, you usually see objective weakness, clear sensory loss, electrodiagnostic abnormalities, persistent neurological deficits, not just radiating pain. If your neurological exam is clean, we should question the entrapment assumption. So let's think logically. If 82% of serious chronic pain cases in trained clinics are due to muscle trigger points, and anatomical variants are common in people without symptoms, making piriformis syndrome the default explanation does not match the data. Before assuming a muscle is trapping your nerve, you test and treat the most common source first. That prevents wasted time, prevents wasted money, prevents chasing the wrong diagnosis. Instead of guessing, run a filter. I built a structured first relief protocol that walks you step by step through how to properly test and treat the gluteus minimus and QL trigger points. No stretching programs, no random exercises, no trial and error. Most people know the same day whether they're finally targeting the right tissue. If your symptoms shift, you're in the right system. If they don't, you've ruled out the most common driver before spending more time and money elsewhere. Link below.